Don't forget about love and purpose. Service is the mission, baby. Listen with love, listen with love, listen with love. Talk to your kids, ask them what's up. And listen up with love. Listen with love, listen with love, listen with love. Kick it with your kids, remember you were one. And listen up with love.
Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another episode of Future First, Focus on Broward's Children. It is very difficult to believe that maternal mortality in the U.S. far outstrips those of other industrialized nations, and that Black women face 3 times the maternal mortality risk as white women. While these are national statistics, sadly, Broward County follows that same pattern. This is a multifaceted issue that must be tackled in order to create a healthier, more equitable, and prosperous community. This involves improving healthcare access and addressing the social and economic factors that impact maternal health before and after pregnancy, as well as with healthy births. To address these factors, we must involve healthcare providers, community organizations, schools, and local government agencies in promoting maternal health initiatives. Key to promoting these initiatives are today's panelists, who are focused on providing needed resources to expectant mothers and their infants. Our guests today are Monica Figueroa King, CEO of Broward Healthy Start Coalition, Caroline Valencia, Director of Maternal Infant Health at the March of Dimes, Rose McKelvie, Administrator at Broward Health, and Kayla Castillo, a certified doula. Welcome, ladies. So excited to have you here today to discuss this incredibly important issue. Monica, I want to start with you. With Healthy Start being that umbrella organization, can you tell our guests exactly what Healthy Start is and why this campaign is so important?
Of course, absolutely. And thank you so much for having us. It's great to be here with friends and colleagues. Again, my name is Monica Figueroa King, and I am proud and honored to be the CEO of the Broward Healthy Start Coalition. And Healthy Start is a statewide funded program that is all about supporting moms and supporting new families. It was created 30 years ago. We've been around a really long time, and it's really aimed to do outreach and education to women, do advocacy and support. Broward's a big urban county. We've got more than 20,000 births in this county. That's a lot of babies to make sure that we're addressing. And sadly, as you said, maternal mortality is a sad issue. Last year, according to the Department of Health statistics, we had 11 women die. And these deaths could have been prevented. And so we really need to think about all the different factors that support women. Healthy Start is available for any woman. So healthcare providers are really required and regulated to do a prenatal risk screen when a woman walks into their clinical office. And so we get a lot of referrals from healthcare providers, but we also get referrals from the community. Anybody can call Healthy Start, and you can reach us on our website, www.browardhsc.org. But we also have a mainline number, which is our Connect program. That's 954-567-7174. And so really, for me, it's about making sure that the community is aware about Healthy Start and that there's a primary central hub that is there and willing to talk to you, whether you're a professional case manager, social worker, a friend who knows a woman who's really struggling. We're here in this community to support new moms and make sure that they live a healthy life and that they can have a healthy infant. And so thanks for having us here.
Thank you. And one of the things that's so important about Healthy Start, that's right in its name, is that it's a coalition, because no one agency, no one organization can tackle any of these issues on their own. And I'm so glad that you asked us to have this conversation and that you have so many wonderful colleagues here with us today. And I want to go to you, Caroline, because March of Dimes also has had healthy births as its mission since they started years ago.
Over 80 years ago, yep, with former President Franklin D. Roosevelt. The mission of March of Dimes at that point was to eradicate polio. We were able to fund research that did so, and then expanded our mission to improving the health of infants. And in the last 10 years or so, I'd say we realized that starts with mom. So it's having the mom be as healthy as she can be to make sure that baby is as healthy as they can be. So about 10 years ago, we had a 39-week campaign where we were working with providers to make sure they weren't encouraging women to have be induced earlier, encouraging them to wait 39 weeks, just to make sure that baby is developing as much as they could in the womb before they're being delivered. And now working with maternal health, making sure that we're addressing those social determinants of health, focusing on preconception health, knowing that some of these maternal deaths, women had comorbidities, were overweight or obese, had issues with nutrition. So also encouraging women to take care of their health even before they're pregnant, making sure they're talking to their doctors about, I'm trying to get pregnant, what things should I do, what specialist should I see to be the healthiest woman that I can be before I, to get my body ready for birth.
And Rose, as the medical coming from Broward Health, that healthy woman, can you talk to us a little bit about what women should be worried about before, during, after?
Absolutely. Caroline was right on point in that women oftentimes come in an unhealthy state when they're pregnant, and trying to deliver a healthy pregnancy from somebody who had a lot of chronic health issues is a very challenging task for us. So I think Caroline's right on point. If you think you want to have a child, really, really work with your primary care provider and your OBGYN to be the healthiest you can be, best blood sugars you can have, the best blood pressures you can have, the healthiest weight you can be. But not just physically healthy, emotional health is just as important. There's lots of research now showing how stress can affect pregnancies and the outcomes of pregnancies. So really work on those things too, and how can I be as emotionally and mentally as healthy as I can be as well, so that you really go into that pregnancy as well as you can be.
And I want to, on that point, the Children's Services Council funds programs that we call supporting moms overcoming maternal stress. We love our acronyms. And for moms out there, or pregnant moms, new moms, please reach out to the Healthy Start Coalition, because they can connect you to those resources. They will come to your home. They'll work with you to address those stressors. It is hard, and that's right from during pregnancy all the way through. You're not in this alone. Anything you hear today, no one is lecturing you. They're trying to make you aware that those supports are available. So thank you for that, and I just couldn't leave out that plug for our moms. And speaking of supporting moms, as a doula, you're offering quite a lot of support to our moms. Can you talk? I don't know how many people even know what a doula is and what kind of role you play. Can you explain?
Sure. So doulas pretty much provide emotional support, educational support. We assist moms in understanding or navigating the process of the pregnancy, the actual birth, and postpartum. Education is one of the largest components of what we do, empowering moms to empower themselves and make this a transformative experience overall for them. And we can only do that when they're aware of what's actually taking place and what to actually look forward to. Motherhood could be overwhelming for a lot. It's transformative for a reason, so a lot does change, but kind of just offering that support so that they can navigate this new time in their life.
One of the things that I think is most shocking that brought us to doing this show is how many deaths occur in that 60-day period right after birth.
Right.
You think, oh my God, I made it through, and now all is well. But that is not true.
Right, right.
So Monica?
Well, right. The statistics are startling, and it's this idea of you're doing a lot of pregnancy support, but then there's also the postpartum. And so there's been sort of a national movement. The American College of Obstetrics has really recommending, it used to be that you would go see your OBGYN at 6 weeks. They're recommending that you go see them at 2 weeks because there's just a lot of concerns around, what's happening with the mom. And that's where we see 75% of the deaths in the state of Florida on maternal mortality or pregnancy-associated maternal mortality is around those post 60 days. So it's really, and it's just about, figuring out, whether it's your caregivers, your doctors, your social service support team, that we're all getting on the same page and understanding all the challenges and the stress and the factors. And, when you were talking about behavioral health or mental health, Cindy, and the support that you all do around the Children's Services Council's Moms Program, the 80% of women experience some sort of baby blues, but almost 1 in 5 women experience perinatal depression. I mean, that's an enormous amount of women. And so while we touch some of them, we've been working really hard to make sure that we're not just talking about the medical clinical side and what's happening with your healthcare provider, but really also supporting women in this idea that they could need some extended support, whether it is through a doula or through a mental health professional. And there's a lot of resources that they can always contact the Healthy Start Coalition at our main number, and that's that 954-567-7174. But there's also a National Maternal Mental Health Hotline that's run out of HRSA. And so there's a lot of opportunities. And not just moms, we're also talking to doctors and really educating. There's over 115 OB providers in the community. And so really getting them up to speed around their care and comprehensive care of the women in their offices, that it's not just around hitting your milestones and your prenatal visits, but how are you feeling and how are you doing? And are you using any substances to calm you down? Whether that's, there's use of marijuana or, because you feel like it calms you, but really trying to understand what's going on and really be honest with your healthcare provider. So we're doing a lot of work on educating our healthcare system around who they can point to and access who maybe mom does need some treatment or she just needs some support to really, help her through this part of her pregnancy or postpartum.
And then, as we were saying, I mean, your body goes through so many changes during pregnancy and after, and trying to understand the difference between what should be happening and what shouldn't be happening. Who'd like to give our moms out there some tips? Rose?
I would say be your own advocate. And when you're just not sure, ask. And I think that's a challenge for many women. They trust us as medical professions so much that they won't advocate for themselves, which is where doulas are fabulous. They help them do that. But if you're just not sure something's right, there's no question that's too stupid. There's no thought that someone else hasn't thought. So ask questions, call your providers, seek out help from Healthy Start, March of Dimes, the other places that help, Children's Council. But I would also say take the opportunity, if there's a mom's exercise group in your community or a support group or anything like that, get yourself connected to other moms, because there's a lot of things that show just having that connection with women going through it makes a huge difference. Breastfeeding support groups, mom support groups, an exercise group. There's lots of those out there that if you can just find one of those, join those groups, and that will help you so much too. That has been shown to really make a difference in postpartum blues and depression, just that connection even.
I want to encourage those moms who participate to be honest. I remember when my daughter was an infant and we were in the Mommy and Me class, and I'd say, I don't know, I'm having trouble, she's not sleeping, or I can't figure out how to do something. And they'd be like, oh, my child is perfect. I didn't have any issues. Like, I know for sure that not all of your children are perfect. So come on, be honest with me, and then like one-on-one later, they might say, yeah, mine's been biting me too, or mine does, won't sleep unless she's holding onto my arm. But, be honest, ladies, with each other, because we're all in this together.
Kind of to piggyback on what she was saying, I think the educational component is so important, just to understand physiologically what's taking place in your body, right? So as a doula, I always stress, and it's part of one of my packages, to include childbirth education. Sometimes when you come closer to the time of giving birth, I know everyone's excited, preparing for a baby shower, reading reviews on strollers, but not necessarily aware of what Pitocin does and how an induction is going to affect the process of your birth, right? So kind of just understanding those things, how birth works, what a contraction is, how often you should expect them, when I should head out to the hospital, but also understanding comfort measures, things you can do for yourself, to advocate for yourself, to make it an integrative process with your partner or your birth team, whoever's supporting you during that process.
What are some of those things?
What do you mean, as far as comfort measures?
Yeah.
Okay, so like counter pressure is something that I love. We have like a double hip squeeze. There are exercises I kind of teach families before. And also how to get yourself in a mental space where you're anticipating the pain, like you know it's coming, but you're also understanding that the contraction is not going to last forever. You are going to get relief in some time, hopefully, right? And, just kind of seeing your way through that, because this is a process that you're a part of, right? Also, I think having the open conversation with your provider. If you have any concerns, having that conversation with your provider. If we create a birth plan together, like yourself and your doula, yourself and your partner, having a conversation of what your birth would look like ideally, and understanding what interventions are available to you if your plan of action doesn't go the way you anticipated.
So one of the things that strikes me is, for the partner in all of this, I mean, we're saying the women themselves don't really know what to expect, especially in a first birth, though I guess each one is different. So, but still, especially that first time, if they don't know what to expect, and I think we tend to be kind of embarrassed about our bodily functions. So how do we educate our partner, and what do you want women to know about what should or should not be happening? We were talking about hemorrhaging before. They may think bleeding is normal. What is normal, what's not? Right. Rose, you want to handle that?
I think, again, you have to ask, assume nothing's normal. When you talk about a partner, they really don't know what to expect. and you have to think about sort of the psychology of what's going on. For 9 months, that mom has been the center of attention, and that father has been sort of set aside. Or at least that's how many feel. Now a baby's come along, mom and dad have both been set aside a little bit, and the baby's now the center of attention. And there's a lot of emotions in that, so be prepared for that. And it's okay to talk to somebody about that. Many women will beat themselves up, or even the fathers will beat themselves up, that they feel like, why am I not liking this? I'm not happy that I'm not the center of attention anymore. That's okay, that's a normal feeling. Feel free to talk about that. But when you're talking about physical things like what's too much bleeding, when is my blood pressure too high, when are things not normal, those are things that all throughout, that's the importance of your prenatal visits, because those are things, as you're going through those prenatal visits, it may feel like we're not doing a whole lot for you. That 5 or 10 minutes may not seem like a lot, but there's a lot happening there. But take that time to ask questions and understand, participate in your childbirth classes, so you can learn as much as you can about what is normal and what's not normal. But at the same time, never hesitate to ask. I've had this headache. My blood pressure seems a little high. This bleeding seems a little heavier than I had expected. Ask those questions again. Advocate for yourself. If there was anything I could say to any mother and father, be your own best advocate. And if you feel like you're being disrespected or not heard by your provider, just continue to demand that you get the answers you need. You are entitled to those answers, and get those answers.
So we know, it's not always easy to get through to your healthcare professional at any time. So what about now it's been added remote, visits by Zoom, or whether it's your healthcare provider or something offered through your insurance company or something, would that be a good avenue for women to use? Or do they need to go into the office
So I
and
think
be
it
seen?
depends. I think it's a valuable tool that has obviously got a lot of, the last few years that women and providers used a lot. So telehealth is an option. There's always going to be cases where going to your healthcare provider in person, particularly a high-risk pregnancy. But I kind of wanted to pick up on what Rose is like, be your advocate, but there's a lot of resources to take advantage of. And so whatever healthcare provider you're visiting, or try to find someone, we're here to help you find somebody, is that they're going to have options for childbirth education. There's some are going to be low cost and some are going to be free. There's a lot of free opportunities, and so I would say taking advantage of services, resources where you're becoming educated, whether it's childbirth education. And for the majority of the population in Broward County, over half the births are covered by Medicaid. And so you have a resource there that is going to help you pay for some services. And so I wanted to make sure that we talked about the fact that doula services are covered for the Medicaid population. And so that's something that we've really been trying to get the information out, making sure that there's a doula workforce that is willing, that works for the Medicaid plans. There's a lot of wonderful doulas in the community, particularly if you're private insurance, that you can access. But for a large group of women, they do have that ability to get those support services, and that's that one-on-one. So maybe you're like embarrassed or shy about asking that question, but that doula can become your like individual advocate that you can ask anything to. And really, she may not have the resource information, but she's going to help you feel comfortable about asking that question. And those Medicaid plans have case management supports. They have supports for you. And so there's a big part of the population that has access to some resources. And so I wanted to make sure we got that message out. Talk to your health plan. If you can't get through your healthcare provider, then contact your health plan. And they are very interested in making sure that you have a healthy pregnancy, because the cost of NOD is pretty big. And so I think we're all interested in making sure that you take advantage of the resources that they're providing.
And just to be clear, the doula is an additional resource, not instead of your
Absolutely.
OBGYN.
Right.
They're
For
your
sure.
additional
Right.
advocate and coach through this process.
Yes, yes.
And do you help dads as well?
Oh, for sure. I love for dads to actually join us for childbirth education. It kind of helps them feel like they're a part of the process, because they are. So realistically, as a doula, I don't arrive during the first contraction, because I don't know where I'll be or where you'll be when that happens, right? So I try to teach the comfort measures, like I mentioned, try to teach almost like self-soothing, so that moms and their partners can process what's actually taking place and have that moment of like intimacy before they, they invite their child earthside, right? So it can take time. Labor, fortunately and unfortunately, it's not like TV. Like your water doesn't break at the supermarket and you have a baby in 30 minutes. It's a process. So because it is a process, just understanding what that is and having that support, not just during the labor, but beyond. I know we mentioned a lot of community resources, but also realizing that the community you have in family or friends or any support systems is also beneficial postpartum. I try to stress postpartum plans just as much as birth plans, and planning for success, right? The less you have to do after you give birth, probably the better. You don't want to have to get up and cook. So if anyone comes to hold the baby, make sure you're there to hold the mama also, and come with some food and some goodies, because that's appreciated.
I think your question about fathers is such an important one too, and there's been a lot, what I would say, across the state and locally, investment in fatherhood programs. And so I would say for fathers who are interested, whether we're doing it through the Healthy Start umbrella or local fatherhood programs, there are some great opportunities for fathers to learn and be with fathers, because they're going to feel comfortable being with their peers and really talking about their concerns. And so there's a lot of, you can call the Healthy Start Coalition and we'll try to connect you to a fatherhood program, or you could potentially be part of your Healthy Healthy Start home visitation, as a father, we involve fathers in that education and making sure that they're getting that information. Some of them are not as willing, but if you're there and you're wanting to, we're happy to include you as part of that educational process.
Well, and moms, make sure you're taking advantage of your partner. My husband was terrified. He had never held an infant before. And so I started him off very slow. I'm like, okay, sit down in the chair, and now I'm going to put the baby in your arms. Just get used to feeling her in your arms. Okay, here's the bottle. Now, of course, right, in my case, I adopted, so I was still pretty healthy and wasn't dealing with the effects to my own body. But to the extent that you can really look at this as a partnership, the better. Like, don't let him get away with, I never touched a baby, so I don't know what to do. I can't change a diaper, I can't feed her, I can't do anything. You gotta bring him along, because you need him, or her, or whatever your situation happens to be.
Right.
Just as the community wants to wrap itself around you as new parents, you need your support system. It's a tough thing to go through alone.
Well, and the truth is, many moms have never held a baby. They come in, they have a baby. We take a couple of days to educate them, and we send them home, and they're sort of like, what do I do with this? And so that's where the resources and things come in, because the truth is, many moms have never, taken care of an infant, or to your point, what's normal and what's not normal in that infant. And I think that's where the education becomes so important. And we forget that. We forget that many people have never cared for an infant, been around an infant, and they go home with this person they're 100% responsible for.
Well, and they throw you new curveballs all the time. So one of my favorite infant stories, I share this with you folks for your information. One night, my daughter would not stop crying. She would not stop. I changed the diaper, I did everything, and I'm like, I don't understand. There's nothing that's calming her down. And because you're no longer supposed to have all the bedding and all of that, I always had her, remember that, you can't have all the bumpers and all that cute stuff. We don't want any unexpected deaths of the infant. So she's in long sleeves and the onesie. And I realized that 3 of her little fingers were like backwards in the sleeve. I'm like, oh, no wonder she was crying. Her poor little fingers are bent back. So then every time I changed her, we counted all of her fingers. And so she learned how to count very young, because every time your clothes changed, we counted to 10. You just never know
You
the
never
things
know. You
that,
never know.
all the obvious. I changed her, she said, oh, I'm breaking her fingers. They're very malleable at that point.
They are very
I wasn't
malleable when they're a
torturing her,
baby.
but it obviously was uncomfortable.
So something I wanted to talk about too, I know we've talked about clinical care and then doula support, but really the other big factor is really, our families are struggling, throughout our community and through the state, and those, I think Rose mentioned it earlier around that stress, and it's that stress that can really impact a pregnancy. Your cortisol levels go up, you can maybe have a preterm birth, and then obviously the stress of having a new infant that you didn't know what you're doing with. And so all of that can affect you, can affect the baby. And so really this issue of how do we support our families in really a concrete way? And so some of what I think Healthy Start's been doing, and a lot of partners are doing, is really, do they need cribs? Do they need car seats? Do they need, supports? We're living in a real estate market where families are struggling to find an apartment that they can afford to rent, or struggling to have meals on the table. And so we're really having to think very differently about what we're doing, and because you can't educate as much as you want to, through childbirth education, when they're figuring out where their next meal is coming from. And so we've got a great community with a lot of partners that are really, I would say, stepping up to the table to the extent that they can. The housing issues, a catastrophe and a challenge, and that's going to take a lot of effort. But I think in other ways, whether it's public, going to grocery store gift cards, and really helping moms, of like that everyday stress of what they're doing with their kids. And so a lot of work in trying to figure out, can we get them into subsidized childcare perhaps? Can we get them into an after-school program that'll help relieve some of the stress? Can we work with our county government around getting them through in the housing list? And so a lot of the work that Healthy Start's been doing is looking at the data in the community, the pockets that we see where the outcomes are very poor, and then, because it can't serve 2 million people or 20,000 women, you have to really focus your efforts. And so some of that work is in, some of the historically, I would say, vulnerable parts of our county where we're focusing our efforts, and whether that's 33311 and 13. If you're in Broward County, you know those zip codes where the infant mortality rate is really high, as is the maternal mortality rate. And so thinking about how we bring resources into the community, whether they may not have to travel as far, and really concrete resources, into those particular stuff. Broward County happens to be one of the 9 counties in the country with the highest Black infant mortality rate. We were fortunate to get a federal grant that has helped us fund some doulas, particularly targeted in that location. So there's no of the administrative challenges or of trying to qualify for somebody to really focus in that community. And I know Rose has been working on making sure access to care in that community is extended beyond the clinic. I don't know if you wanted to talk about that.
Yeah, and Marcia Dimes talks a lot about this. Broward County has a lot of areas we call OBGYN deserts, meaning there's not a lot of access to care. And in the 33311 zip code, I think our clinic in Court E. Brannon is the only provider of prenatal care in that entire zip code. So we're doing a lot of work with Marcia Dimes and other organizations, Marcia Dimes and Healthy Start, on access, and CCP, who is a Medicaid provider. So we're actually going to be opening a 3rd location in those zip codes so that we have an extra location for care. But not just the care, as Monica says, doing things different. About 2 years ago, we started having this conversation, and we created our sort of umbrella. We call it Every Mom, Every Baby, because we do believe every mom and every baby is valuable and deserves the best outcomes. And I just sat there and I said, I hear a lot about this politically. I hear a lot about this from church leaders. I hear a lot about this from a lot of places, but nobody's really trying to fix the problem. So if we're going to talk about it, let's fix the problem. So we looked at access to care. We've worked with Monica. We're now offering Centering Pregnancy, which is a national model of group prenatal care. And what we found interesting in our first group, which was not even under the Centering name, just we did it ourselves, was the amount of stress that each of those women experienced, but yet how that being in that group setting helped them feel better, open up, become more vulnerable, and really educated them. So we did our first group of 6 women, and they all carried babies to term.
Yay.
And I don't think any of them even had complications, so it really showed me the value of that model of care. And to your point, telehealth, we're fixing to work with the state of Florida and implement a very comprehensive telemedicine program, because women struggle for transportation, and what are they going to do with their children? And we can truthfully, through good technology, provide those first visits in a telehealth model. So we've got a partner we're working with there. We work with Marcia Dimes and a green car company to get transportation to women. So we've really set out to say we really have to look at this from a holistic place. It's not just about clinical care, it's about taking care of that whole woman and her family. And how do we address all of these needs? Because to Monica's point, if I'm worried about where my next meal's coming from, all the education in the world, keeping my blood pressures under control and doing my prenatal visits are of no value to me, because I'm just worried about how I'm going to feed my family the next meal. Right. And unfortunately, we have lots of women that's their biggest thing on their mind is how am I going to feed my family and where am I going to live next month,
Right.
because I'm losing where I'm going to live.
I think kind of to piggyback on what they were saying, introducing a new baby into a family unit shifts things for everybody, especially if this is a family with multiple children. If the mother was in a predicament where she was working, now she has to take into account, I'm going to be, off for maternity leave. What's going to happen to transportation for maybe my other children or my other child care? What's going to happen as far as this income being down? So kind of understanding where community resources can step in the gap for you, having that support to know which resources to actually apply for, which ones you might qualify for. I think that's so important. Wraparound services benefit the whole family in reality, and it's definitely essential to know that it's an option.
So the most important number for anybody watching who is pregnant or thinking about getting pregnant is 211. That is first call for help. And all of these issues that we're talking about, that is the information and referral line, 211. Dial it on your phone. There are resources out there, and I want you to find them. But I now want to turn to Caroline, because March of Dimes was mentioned many times, and let you talk for March of Dimes about what you're up to.
Sure. So as Rose mentioned, we acknowledged that there was an issue with getting women to prenatal care. So we were able to partner with the Cora Ibranian Clinic and Green Cars for Kids to be able to provide an electric vehicle to bring women to their prenatal care appointments. And I've heard great things about it. I've even heard that the drivers know when the woman is due. They'll remember, when they had their last visit, creating that sense of community. And then going back to the group prenatal care, hearing the social support that these women are finding with one another, knowing that in other models or in other groups, after baby is born, they still stay together, they do walks together. It's that sense of community. And in that group prenatal care session, having the medical provider there where you can openly discuss topics that maybe you don't want to talk about. And if someone, is saying, oh, I'm having an issue sleeping, and other women say, oh yeah, me too, then the provider is there to give some tips. So I think the group prenatal care model is really wonderful, and I would love to see more of them. And I think there have been a lot of points here that are important. Also with March of Dimes has an app called Compass, which has a lot of questions, or where you can answer a lot of questions. So for women who are pregnant or after they have baby, especially a baby in the NICU, which is incredibly difficult, they can go to that resource as well.
So that's an app, did you say?
Compass by March of Dimes.
Compass by March of Dimes. Okay, we'll throw that up on the screen as well for people.
Yeah, awesome. And then another point I think Monica mentioned earlier is about that postpartum period. And so while we hope that women are going to their postpartum visit or visits, that they're talking to their provider about issues they're having and making sure they're getting connected to any other specialist they need to see. So a few years ago, Florida passed postpartum Medicaid, which means women that had pregnancy Medicaid now have Medicaid 12 months after their pregnancy, including if they had a loss. Now we know the system isn't working always as it should be, but you should be eligible for that Medicaid for 12 months, which means you can access full Medicaid benefits, including dental care, emergency services should you need it, primary care. So it's important that after you have that comprehensive OB visit, you find out who is your primary care provider going to be. Find that family physician that's going to see you for your ongoing care. That way, if you have any issues, you can continue to get that care taken care of. I've heard the analogy about a woman being a candy wrapper, and once baby is born, they throw the candy wrapper out, and it's all about the baby, all about the candy. But we can't think of women like that. They should also have a healthy postpartum period and a transition into the rest of their maternal or woman care the rest of their lives. So I also just want to reiterate the importance of, just like we are running around making sure baby's going to all their well child visits, mom needs to take care of herself too, and the community needs to rally around her also.
Now, one of the things, there's a national campaign about listening to her, because it's all well and good. You ladies are fantastic, and I know any woman who comes to you and says, I'm having a problem postpartum, you're going to listen to them. But not all doctors are doing that. So how are we making sure that women are listened to, especially women of color? Because that has been, pretty nationally recognized as an issue.
So I'm glad you raised this. So the CDC, the Centers for Disease Control, has a campaign called the Hear Her campaign, because it really is around women who may be and particularly women of color. And the idea is, was their healthcare professional listening to them? And so there's a great advertising campaign called the Hear Her campaign. It's aimed at healthcare professionals, but also women, for them to hear other women's stories and how maybe somebody wasn't being listened to. I think many of you know, like the famous tennis star, Serena, and she had issues, and it was all around not being listened to, and she advocated for herself. What I am happy is that Florida has one of the few states that has it's called the Florida Perinatal Quality Collaborative. And so their mission is around improving the quality of care provided by birthing hospitals. And so they are focused on a lot of different initiatives. So one of them is particularly around postpartum care and the continuity of postpartum care. Broward Health is one of the participants. We have other hospitals in our county, and they've really been focused on making sure that the hospital system is integrating this idea of hearing her, and so that doctors are getting this message, the nurses are getting the message, and building opportunities throughout the discharge to really account for what is a woman telling her, and that letting her know, do this, do that, this is your 2-month, this is your doctor, this is where you need to go. And so, we have access to this national campaign. They have some really great videos and PSAs that are available on their national website for the Hear Her campaign. But I also, for any healthcare professional who's not associated with a Florida Perinatal Quality Collaborative and does the work in those birthing hospitals, they're a great support and a really done some initiatives to improve that. I don't know if you have any thoughts on the postpartum initiative that they're working on.
Well, I think, as Monica said, that initiative is really around that 2-week visit and the importance of that 2-week visit. We're not looking clinically so much at mom at that point. We're really looking at just how is she doing, how are things going, and a little bit of clinical, but that's not nearly as clinically focused as support focused. When you talk about physicians, and you're correct, one of the loudest messages we hear are, nobody listened to me. We have our chairman of our OBGYN department will tell you, as a physician in a hospital she delivered babies at, she had a very complicated pregnancy, and said people didn't listen to her. And here she was, a physician in that hospital. But one of the things we really are trying to educate our staff on, our physicians, our nurses, is oftentimes when we think we're being comforting, we're being dismissive. And I'll give the example of, she'll say, I think, my head's hurting really bad, and I think there's something wrong. And we'll say something like, everything looks good, you don't need to worry about it. And we think we're consoling them. But lo and behold, something happens 2 days later, and what does she think? They dismissed me when I tried to tell them something was wrong. So, really trying to educate to our healthcare providers, sometimes you're being dismissive when you think you're being encouraging. So really sit down and listen to what they're saying to you and gain understanding around that conversation.
Well, because pain should be an indication of something, and that is one of the complexities of the human body, right? There's some tools that you have to figure out what it is, but if there's really pain, it's got to require further exploration. But I think we're often told, well, it's in your head, or it'll pass.
Right.
Right.
Is it a contraction, or do I have a brain bleed? I don't know.
And I think that's where the role of doulas are so important too, is I don't like to use the word empower because we all have power within us, but it's more of realizing that the birthing person has that power and it's their journey, and it should be a beautiful, respectful journey. And if at any point they don't feel like they are being listened to have that doula or that person next to you to say, no, really tell them what's happening. Write it down so at your next visit you can present it to them. I see it as a two-pronged approach. We want the professionals to be listening, but we also want the individual to know that their voice matters and that they should be able to share any concerns that they have and share it with others so that, when it comes for delivery time, if they feel like they're not being heard, their support person can say, hey, you know what, I really think you should look at them and take them into consideration.
I think also it's a consideration to maybe go back to the drawing board. Like, is this physician or like this obstetrician a good fit for me and my family right now? Sometimes you might have to switch practices if you have that, within your power, right? Sometimes it might come to seeing if you have better chemistry with another provider and if you feel more heard there. I think it's always an option to go back to the drawing board.
And culturally, I think it should be someone culturally appropriate. I always remember where we would go and do these meal prep classes and we'd be introducing asparagus and all these foods to a Hispanic population. They're like, I've never seen this in my life. I'm not going to go to the grocery store and buy this. So understanding who is the population and what can we make work with, what are you used to, and how can we introduce some of these high nutrient, low caloric foods that fits your needs. That's something you're actually going to put into practice with your family.
Really good point. In terms of resources, I want to go back to something we were talking about a long time ago, rolling back a little bit, to cribs.
Yes.
Because when you're talking about low-income families and all of those things that you're preparing for, one of those is cribs.
Yeah.
And we do have a program in Broward County, funded by the Children's Services Council,
That's a great segue.
but run by the Healthy Start Coalition.
Thank you. Yeah, I mean, sadly, as if you don't know, one of the leading causes of infant deaths are it's happening in an unsafe sleep environment and for various reasons. And so we've been honored to be able to run the Safe Sleep program the last 5 years or so in the community, but it's existed a very long time. And this idea of really sharing that education, back to education, information. You grew up with your grandparents doing it a certain way, and so just really educating the entire family. So not just the mom, but the spouse, the partner, the grandparents around what you can do, and it's always alone on their back in a crib. And so if you don't have a crib, a safe space, a play yard. So the Healthy Start Coalition is available to do training to professionals, to parents. We provide cribs. And the other is modeling behavior. We also do work with the hospital systems and the nurses, because even in those professional environments, they're still going back to maybe ways that they were taught by their grandparents. And so making sure that our nurses on the maternity floor, on the NICU floors are really, that they're really also passing along the message to our families around this. It's sad when we see an infant death related to safe sleep. It is one of the most common reasons, along with drowning. So it's a very preventable issue, and there's a lot of resources. It really is around messaging and back to culture. It's like really getting to those individuals to understand. And sometimes, often, it's not necessarily the person, but it's that caregiver, that they left the baby in the care of their spouse, their boyfriend, the partner, the grandparent, and who thought it was okay to leave them on a futon or on a sofa, or on a crib that had bumpers that that really can cause, sadly, a tragic death. And so we do a lot of messaging around that. So thanks for bringing that up.
Yeah, the mattress needs to fit well inside. Tight-fitting
sheets, crib.
The bumpers are so cute. Don't use them unless you're just to make the bed, but not when the baby is
Not
in
when the
them.
baby's
Stuffed
there.
animals.
You can decorate the crib as much as you want when the baby's not there.
Right.
When you put the baby in, all of that has to come out.
Well, and I think, that's a message for grandparents because, my oldest child's 35 years old, and in those days you put them to sleep on their stomach.
Yeah.
And, and they slept beautifully, nothing was wrong with that. And so I think for moms and grandparents, even to message to grandparents would be, hear what we're saying today, because things are different. We know things differently. And yes, it worked beautifully for you, and that's great, but there really are new standards out there, and there are new ways that are more preventable. And even let us be the bad guy. When you're in the hospital, if grandma's arguing about the baby sleeping on their stomach, let us be the bad guy. We can deliver that message. But I would challenge grandparents that if we're teaching things to your daughter or son and the safety of their child, please listen, because it is different today. And, I'm speaking as a grandmother. There are times I want to say, it really is okay, but it's not. It's not.
Well, and it's quite possible all 9, 10, 12 of your children slept on their belly and all was well.
and did-
But maybe your neighbors did not. And what we know now is that can be a problem. Not for every child, but you don't know, you can't tell from looking at them which child is not going to react well.
And even if it's one child, it's not good for. You don't want your child to be the one that it's not good
Right.
for.
And you can't tell from the outside.
That's true.
We only have a couple minutes left, so any final thoughts?
Just a final thought. I know we spent some time around behavioral health and postpartum depression, but the state of Florida, the Pregnancy-Associated Mortality Review did an urgent mortality message last year, and it was really around substance use. That substance use by women was one of the causes of death, and so just there's a lot of talk about opioid use and fentanyl and drugs and that thing. So being sure that we have the supports in the community, we're available to link you to services. Whatever you're dealing with an addiction, it's a health condition that we want to be able to help you and make sure that you have a healthy pregnancy and a healthy birth.
And very important message. Anybody else? Last thought? We have about a minute left for you. Because I want to make sure that we can show some of those PSAs so that women understand what's available to them.
I would say that there's no, to Rose's, there's no dumb question. There is a main number, 954-567-7174. Call. You've got a friend, you yourself are struggling, you just need to figure out a resource if it's related to around your health, whether it's pregnancy or infant related. We're there to figure out and work with you and try to get you in the right direction. And there is no dumb question.
No dumb question. Okay, I understand we have 2 more minutes left. So, last thoughts? No?
I think I would say enjoy this time. Advocate for yourself, but enjoy this time. There'll be no other time like it, but take great care of yourself while you're doing it.
That is a great place to end. Enjoy it. Know your body. Understand that while it's going through changes, that you need to know what's happening, because then you can communicate better with your caregivers and be that advocate, as you all said.
Right.
Well, this has been fascinating. Thank you all so much. You all bring a wonderful passion and commitment to this work, and it is so important for our community and for our moms and babies. Thank you to Monica Figueroa King, Caroline Valencia, Rose McKelvie, and Kayla Castillo for an impactful discussion benefiting our mothers and our babies and our dads as well, our families and community as a whole. I've been your host, Cindy Arenberg Seltzer. For this or any other episode of Future First, focus on Broward's children, go to our website, cscbroward.org, where you can access our YouTube channel, follow us on social media, and remember to join us next time on Future First, focus on Broward's children.
Being a mother is amazing, and we have this story together. We both survived. And not everyone who faces what I faced gets to say that.
I had constant chest pains. It felt like someone was stabbing at my chest. It felt like I couldn't breathe for about a good 3 to 4 minutes, and it was painful.
I had heard of preeclampsia before, but I had never, experienced it due to the fact that my first pregnancy was so normal. So once I started having the symptoms, it was very, very scary.
I knew with this pregnancy something didn't feel right.
If you know in your gut that something is wrong, something is wrong.
I told my family members and they were like, it's just pregnancy related. You know, everyone goes through it. I told my spouse what was going on. He was like, you're exaggerating.
And then when I would voice my concerns, sometimes it would be, oh, you're pregnant, your feet are supposed to swell, or oh, you're fine, you're pregnant, like it's fine, but I didn't feel fine.
I didn't have what I needed, the tools. I didn't know who to talk to or how to talk or how to speak up for myself. I was scared. I was scared a lot of the time because I just felt like no one heard me.
No one should have to feel that way at all.
I felt like I don't think that this is normal. I don't think that I should be feeling like this. So I went to a different hospital and they found an 11-centimeter abscess on my uterus. They'd never seen this before, and they said that had I not come in, it could have easily been a there's nothing we could do situation. So even if those around you aren't listening, or they're trying to pacify what you're feeling and telling you this is just normal, trust your gut and know that it's not normal if you don't feel it's normal. And tests may come out, to say that it's perfectly fine, but you'd rather err on the safe side and know that you're okay.
It's extremely important to hear women because you don't know what they're feeling, but they do.
My advice to a woman is, you know yourself, you know your body. If it's nothing, then let the doctor tell you that it's nothing, because you'd rather be safe and it be nothing than have not spoken to anybody and it be something very serious and something that is preventable.
I just really want women and their support systems to advocate hard. It could mean your life, it could mean your child's life. There's no little questions when it comes to your health care.
I want to share my story to help other women speak up and be heard. Hear her.